Richard was right. I've been charmed by a sociopath. Why didn't I listen?
Most discussions of Dr. Melfi, when it comes to Employee of the Month, revolve around her decision not to tell Tony about what happened to her.
You want to say something?
No.
But one of the overlooked choices is the fact that she keeps him as a patient.
Since we last met, I've been thinking about your course of therapy.
You're the doctor.
I think you're ready to move on to behavior modification therapy.
What's that mean? Talk to somebody else?
With psychoanalysis, there's a primary focus on the unconscious mind, repressed childhood memories, and hidden motives.
Since the ducks left, I guess.
The ducks that preceded your losing consciousness. Let's talk about them.
With behavior modification therapy, it's about observable actions and changes.
I'm just introducing the idea. Something for you to think about. I'm going to bring in some things for you to read about behavior modification therapy.
Let's go back to earlier in the episode. Dr. Melfi says to Elliot,
I've been charmed by a sociopath.
So here we are, season 3, episode 4. Why is Dr. Melfi coming to this conclusion right now? Weren't there other situations that presented red flags a while back?
But you still have your doubts?
About therapy? No. Give it another chance. Got a lot of good ideas here. And how to cope. You're in danger.
Get out of here. That's not fair.
Fair? What are you talking about fair? Oh, God, it's fair. They don't give a shit about fair.
In any case, she continues to see him.
Why didn't I listen?
So why is she saying this to Elliot now? Aren't they making progress, according to her own words? And this is right after the episode where Tony remembers his first panic attack.
Understanding root causes will make you less vulnerable to future episodes.
My fucking head is swimming here.
We're going to have to stop. It's a lot to process. But we've made real progress today. Good work.
But when Tony comes back for therapy in the following episode, Dr. Melfi seems convinced that they'd officially hit a wall.
Yeah, my parents in the pork store. I know. Yeah, that was interesting.
Have you thought at all about that?
How do people find the time? I haven't had a panic attack since.
You've gone months without them before. The conflicts that caused them and your depression are buried deep inside you.
Dr. Melfi tells him the conflicts that caused them and your depression are buried deep inside of you. But then in the next appointment, she tells him that she thinks he's ready for behavior modification therapy. But it seems like they still have a lot more digging to do.
Feel the fear and do it anyway. You gotta be fucking kidding me.
The title leaves something to be desired.
Feel the fear and do it anyway. For Dr. Melfi, I suppose she could interpret this in a couple different ways. Feel the fear of having Tony Soprano as a patient and treat him anyway, or feel the fear of his absence, but still let go of him anyway. Most of the debate around Employee of the Month is whether or not Dr. Melfi should have told Tony about her rape, particularly given the horrendous job the cops do, where this Rossi ends up right back on the street due to a mix-up in the chain of custody. But she doesn't tell him. We think of this as a win for the social compact and for Melfi's conscience and her belief in the rule of law. What about the rest of the situation? Her plans for his therapy?
Who do I dig with?
You know psychotherapy is limited in the treatment of anxiety disorder. Now, you've medicated Sopranos.
So everybody turns government witness. I feel exhausted just talking about it.
Well, with today's pharmacology, no one needs to suffer with feelings of exhaustion and depression.
I love how the moment that Dr. Melfi gets out her prescription pad is when Tony tells her that he's exhausted from the RICO statute.
You've helped him gain what insight he's able to absorb.
What you witnessed that day, where the meat came from, I'm sure it was too much for you then, too. That's why you short-circuited. Puberty. I can't believe I revealed his name.
Why did you?
I think Dr. Melfi's accidental slip of the name Tony Soprano to Elliot may have been a Freudian slip of her own to make her feel more obligated to end her relationship with Tony, because now the violation is external, but she doesn't.
If I hadn't have been on the phone with you, maybe I would have seen that guy in the stairwell.
What?
Are you so ashamed of your background that any misdeed by an Italian somehow damages your self-esteem?
And is it possible that all of Richard's pushing and pushing has now backfired?
Let's talk about this another time.
That's why you didn't want Tony here. It had nothing to do with the marital situation. All along, it was so that your cultured Italian friends, who were born and raised on Arthur Avenue, I might add, wouldn't meet your Gavone son-in-law.
He made us all look like Gavones.
Whatever we are, I am proud of it, unlike you, obviously.
I have always been proud of my
Oh,
heritage.
bullshit.
What are you somehow implying by all this? I'm ashamed to be an Italian American?
With all the poverty, starvation, ethnic cleansing, and generally horrible shit in this world, you devote your energies to the protection of the dignity of Connie Francis.
She felt like Richard was even more horrified when he heard the rapist's last name was Italian, Rossi. Maybe this is sort of Melfi's way of getting back at the justice system, at law enforcement.
The judicial system has gotten much better in dealing with sexual predators.
Oh, yeah.
And this professional and ethical misstep of hers, revealing Tony Soprano's name, leads to her cold cut later on after Elliot reveals his identity to their colleagues.
Da, 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 da,
Elliot!
da, da.
What are you talking about? We're making progress. It's been 7 years.
I give my patients everything I've got. And when something like this happens, I'm devastated.
You're cutting me loose just as my son got out of the hospital for trying to kill himself?
One of my patients committed suicide because I wasn't available to her. Since you are in crisis, I don't want to waste your time.
Hey. Come on. I mean, you want to say something?
Since I am in crisis, I'm gonna waste your time.
Maybe you can recommend somebody else.
I would never ask another colleague to get involved. There's a doctor in Bloomfield you could see. Do you want some names? How many more people have to die for your personal growth?
Flag on the play. I'm pretty sure you said Tuesday.
Nothing wrong with wanting to be safe, Jen.
There's nothing wrong with wanting to be safe, Jen. Even without intending to do so, it's possible that these words from Elliot gave Dr. Melfi the feeling that she was later justified in keeping Tony around for her safety. There's nothing wrong with wanting to feel safe.
And I've been thinking about your behavior therapy idea. Maybe you got a point. You know, I could use some help with a few things, and if they can help me there, you know, I should go there.
No.
The fact that Dr. Melfi doesn't tell Tony about the assault, but keeps him as a patient, not just dropping the behavior modification therapy suggestion, but giving Tony an explicit no when he brings it up again. It's like she's leaving open the possibility of telling him. Just because she said no right then doesn't mean that she won't tell him at all or that she can't tell him at all.
Because the last couple of times I've been getting the distinct feeling that you're giving me the boot. Melfi. What part of the boot you from, hun?
Thanks for watching. I'd love to hear from you.